Hello, guys. The topic for today is Meniere's disease. It is also known as endolymphatic hydrops. So, first, we'll know what is the basic concept of Meniere's disease. So, Meniere's disease generally refers to increased production of endolymph. As we know, the endolymph is produced by the stria vascularis, which is present in the scala media and absorbed by the endolymphatic sac. So, this is the rough diagram in which this represents the cochlea. This is the saccule, this is the utricle, this is the semicircular canal, this is the endolymphatic duct and endolymphatic sac. So this is the area of absorption of the endolymph. So normally, if there is increased production or decreased absorption of endolymph, it may lead to Meniere's disease, which is also known as endolymphatic hydrops. So first, we'll look about the defective absorption. Defective absorption may be due to ischemia of the sac, poor vascularity, and poor absorption by the sac. Next may be increased production, which is due to vasomotor disturbance, allergy, sodium and water retention, hypothyroidism, autoimmune, or viral etiology. So, first we'll look at vasomotor disturbance. So, vasomotor disturbance may be either due to sympathetic overactivity. So, due to sympathetic overactivity, there will be spasm of the internal auditory artery, which will interfere with the cochlear function and sensory neuroepithelium function, which may lead to increased production of endolymph. Another reason may be anoxia of the capillaries of stria vascularis. So we know that stria vascularis produces endolymph. So when there is anoxia of these capillaries, it leads to increased permeability, which will lead to transudation of fluid and increased production of endolymph. Next cause is allergy. Allergy may be due to food or other inhalant allergens. Inner ear acts as shock organ, which will produce excess of endolymph in response to this allergens. Next is sodium and water retention. So excessive retention of fluid. Hypothyroidism. In case of hypothyroidism, the Meniere's disease benefits from thyroid replacement therapy. Other causes may be autoimmune etiology or viral etiology. So viruses involved are HSV, that is herpes simplex virus, cytomegalovirus, generally has an uncertain role. Autoimmune etiology, it may be associated with HLA-B8 or HLA-DR3. So now we'll look at the pathology of Meniere's disease. Meniere's disease is generally distension of the endolymphatic system. So location, it initially occurs at the cochlear and saccule, and then it further involves the utricle and semicircular canals. So cochlea and saccule will be involved, and to a lesser extent the utricle and the semicircular canals. So in this distension of the scala media, which is present in the cochlea initially, and this will lead to bulging of the rhinous membrane. So due to bulging of the rhinous membrane, this rhinous membrane herniates to the helicotrema through the scala tympani. So after this bulging, there will be a rupture of the rhinous membrane. So due to the rupture of the rhinous membrane, there's leakage of the potassium into the perilymph. Due to the mixing of the endolymph and perilymph, there's leakage of potassium into the perilymph, which will lead to depolarization of neurons, which is responsible for acute attack of vertigo. So this distended saccule may come to lie against the stapes foot plate, and distended utricle and saccule may also show outpouchings into the semicircular canal. This is a rough diagram in which this is the scala media, this is the scala vestibuli, and this is the scala tympani. This is the organ of Corti present on the basilar membrane, and this is the rhinous membrane. So the endolymph is produced in the scala media. So when there is increase in this endolymph, it will lead to bulging of this membrane, which will further rupture, leading to leakage of this endolymph into the perilymph. So endolymph, as we know, is rich in potassium ions, whereas perilymph is rich in sodium ions. So when this potassium ions leaks into the perilymph, it will lead to depolarization of the neurons, which will lead to an acute attack of vertigo. So now we'll look at what is Henneberg's sign. So the Henneberg sign refers to false positive fistula test due to saccule lying against the stapes foot plate. So as we have seen here, not only the scala media is affected, but saccule is also affected, which gets distended and lies against the foot plate of stapes. So due to this, there is this positive Henneberg sign, that is false positive fistula test. That is, there is no presence of fistula, but the fistula test will be positive. This due to this, the pressure changes will produce vertigo. Now we'll see the clinical features of Meniere's disease. So it occurs, the age group involved is 30 to 60 years of age and almost equal in males and females according to Scott Brown. And now we'll see the cardinal symptoms, which are vertigo, sensory neural hearing loss, tinnitus, and oral fullness. Let us now look into each of them. So first we'll look at vertigo. So vertigo occurs as sudden attacks. What is vertigo? Vertigo refers to sense of rotation of a person or the surroundings. The vertigo in case of Meniere's disease occurs in sudden attacks. So most commonly it lasts for 20 minutes or more than 20 minutes and occurs in sudden attacks. It occurs in clusters with periods of spontaneous remission which lasts for weeks, months, or years. So, there are periods of spontaneous remission, which means there's a period in which the vertigo does not occur after the sudden attack, which lasts for weeks, months, or years. It is accompanied by nausea, vomiting, ataxia, and nystagmus. But in severe cases, it may also be associated with bradycardia, pallor, cold sweats, abdominal cramps, and diarrhea. How will we know that the sudden attack of vertigo is about to occur? So what are the warning symptoms of oncoming attack of vertigo? In case where the vertigo is about to occur, before the vertigo there may be oral fullness or change in the character of tinnitus seen in some patients, but sometimes it may also occur without these warning symptoms. Now we'll look about what is Tullio's phenomena. Tullio's phenomena: exposure to sound produces vertigo due to distended saccule lying against the stapes foot plate. So when the ear is exposed to sound, this will lead to production of vertigo because of the saccule lying against the stapes foot plate, as the sound is transmitted into the inner ear, leading to production of vertigo. Next, we'll look at sensory neural hearing loss. So, sensory neural hearing loss, it accompanies vertigo. Uh, Hearing will improve after the period of attack and may be normal during the periods of remission. So, this hearing loss occurs only during the period of attack and will improve after the period of attacks. The characteristic of hearing loss is it is fluctuating hearing loss with recurrent episodes. Remission may not be complete, and some amount of hearing loss will be added in every attack, leading to slow and progressive deterioration of hearing, which is permanent. That is, if there is a hearing loss is generally seen during the periods of attacks, but generally there's normal hearing after during the periods of remission. But with if the episodes occur again and again, this remission will not be complete, and some amount of hearing loss will be added at each attack, leading to progressive permanent loss of hearing, which is very slow. And next we'll look at distortion of sound and intolerance to loud sounds. Distortion of sound: so a tone of particular frequency may appear normal in one ear and of higher pitch in other ear or the affected ear, leading to diplacusis. So if we give a tone of a particular frequency, the on the affected ear it may appear of higher pitch, but in normal ear it will obviously sound normal. So this will lead to diplacusis, that is different hearing in different ears. And then we'll look at intolerance to loud sounds, which will occur due to recruitment phenomena, which is positive in this case. Tinnitus. The tinnitus will be low pitched and roaring type of tinnitus, which is aggravated during acute attacks, and change in pitch or intensity of the tinnitus is a warning symptom of attack, as we had seen already. So, oral fullness, it may accompany or precede the attack, and emotional upset may also be seen with the patient. Now we'll see about the examination of Meniere's disease. Meniere's disease can be examined by otoscopy. So if we do otoscopy, the tympanic membrane will appear normal as the defect is in inner ear. Nystagmus, it is seen during acute attack. The quick component of nystagmus is towards the unaffected ear. During folk test, since it is a sensory neural hearing loss, the Rinne's test will be positive. Weber's test will be lateralized to the normal ear, and absolute bone conduction or Schwabach's test will be shortened. Now we'll look at the investigations, in which the first one is pure tone audiometry. It reveals sensory neural hearing loss. There's no airborne gap. So airborne gap is a feature of conductive hearing loss which is not seen in case of Meniere's disease. So it affects the lower frequencies initially, which will further increase to affect the higher frequencies. Therefore, the curve is of rising type or ascending type or upsloping type of curve. And at 2000 hertz, a tent or increase in the frequency, increase in the hearing at a particular frequency may be seen. And later, higher frequencies may also be affected, leading to a descending, downsloping, or flat type of curve. So this is a type of curve seen in pure tone audiometry, which is ascending type of curve in initial stages. Speech audiometry. So it is 55 to 85 percentage in between the attack, but will decrease further during the attacks as the hearing loss will decrease, especially during the attacks. Special audiometric tests will include recruitment test, which is generally positive, which differentiates cochlear from retrocochlear lesions. In cochlear lesions, recruitment test is positive, whereas in retrocochlear lesions, rollover phenomena will be positive. CC score is generally greater than 70 percentage in Meniere's disease, which is normally less than 70%, so equal to 70 percentage in normal cases. CC refers to short increment sensitivity index. That is, it records the sensitivity of the ear to small increments in sound or short increments in sound. Tone decay test is less than 20 decibels in case of Meniere's disease. Next, we'll look at electrocochleography, which is the most important part of examination. The summating potential by action potential will be more than 30 percentage in case of Meniere's disease. The summating potential is the potential produced by the sum of the hair cells, whereas action potential is produced by the nerve fibers. So normally, the sum if this is a normal summating potential by action potential, this is the summating potential, and this is the action potential. But in case of Meniere's disease, the summating potential is increased, whereas the action potential will remain the same because of excessive activity of the hair cells. That is potassium, and then there is depolarization of the hair cells. So there is excessive activity of the outer hair cells, which will increase the summating potential. But the potential produced by the nerve fibers are constant. Therefore, the action potential will be the same. Therefore, the ratio of the summating potential by action potential is increased in case of Meniere's disease. That is more than 30 percentage. Caloric test, there is canal paralysis on the affected side and directional preponderance on the healthy side, or both of these may be seen. Glycerol test. Glycerol is a dehydrating agent which reduces the endolymph, so therefore it will reduce the pressure of the endolymph and improve hearing. So in this, 1.5 ml per kg of glycerol will be given with equivalent amount of water and little flavoring agent or lemon juice. And then the audiogram and speech discrimination scores will be recorded 1 to 2 hours after the ingestion of glycerol. If there is improvement in 10 decibel in two or more adjacent octaves, or a gain of 10 percentage, that means the test is positive, which means glycerol is acting as a dehydrating agent and it is actually improving the hearing. Therefore, the test is positive. That is, the gain should be of 10 percentage. Imaging tests, we can do CT, MRI, or MRI with gadolinium. So in CT, hypoplastic endolymphatic sac may be seen. MRI and MRI with gadolinium, smaller and shorter endolymphatic sac will be seen in case of defective endolymphatic sac function.